When someone is experiencing an opioid overdose, every second counts. But there's a life-saving tool that can make all the difference: naloxone. In this video, we're going to break down what naloxone is, how it works, and why it's so important in the fight against the opioid epidemic. Plus, we'll look at some key stats that highlight just how crucial this drug is in saving lives. Naloxone, also known by the brand name Narcan, is a medication used to reverse opioid overdoses. It works by quickly blocking the effects of opioids, especially the dangerous effect of respiratory depression, when breathing slows or stops, which is the primary cause of death in opioid overdoses. Since 2014, naloxone has been used to reverse more than 200,000 opioid overdoses in the United States alone, showcasing its life-saving potential. Naloxone works by binding to opioid receptors in the brain. These receptors are where opioids like heroin, fentanyl, and prescription painkillers attach to cause pain relief and euphoria. But in the case of an overdose, these opioids can overwhelm the system and stop breathing. When naloxone is administered, it displaces the opioids from these receptors and restores normal breathing almost immediately. It doesn't get rid of the opioids in the body, but it stops their effects long enough for emergency medical help to arrive. Naloxone begins to take effect within 2 minutes of being administered, which is critical in reversing the life-threatening effects of an overdose. Naloxone can be given through a nasal spray Narcan or through an injection. The nasal spray is the most commonly used form for bystanders or non-medical individuals because it's easy to use and doesn't require medical training. Emergency responders may use injectable naloxone or a pre-filled syringe, but both forms are designed to deliver the drug as quickly and effectively as possible. In 2019, nearly 56,000 nasal spray doses of Narcan were distributed across the United States through community-based programs aimed at preventing opioid deaths. Naloxone is a game-changer in the battle against the opioid crisis. It's responsible for saving thousands of lives each year. The real impact of naloxone is not just in the number of overdoses it reverses, but in the number of second chances it gives people to seek help and enter recovery. A study by the National Institute on Drug Abuse (NIDA) found that naloxone programs in states like New York and California have been associated with a 20 to 40% reduction in overdose deaths in communities where they were implemented. The opioid epidemic is still claiming lives every day, especially due to the rise of fentanyl, which is 50 to 100 times stronger than morphine. Fentanyl overdoses can be particularly difficult to reverse, as the dose needed for reversal may be higher than what is typically used for other opioids. This makes naloxone even more important, as its ability to reverse even the most potent opioids, like fentanyl, saves countless lives. In 2020, fentanyl was involved in more than 60% of all opioid-related overdose deaths in the U.S., underscoring the need for naloxone's broad availability. One of the major advantages of naloxone is its accessibility. It's available in most pharmacies without a prescription in many states, and can be distributed in harm reduction programs, schools, and even by first responders. By 2021, over 1.2 million naloxone kits had been distributed across the United States through both public health programs and community-based organizations. After naloxone is given, the person who has overdosed will usually start to wake up within minutes. They may feel confused, agitated, or upset, and they may experience withdrawal symptoms, including nausea, vomiting, sweating, shivering. It's important to remember that naloxone only works for a limited time, about 30 to 90 minutes. This is why it's essential that the person who has overdosed is monitored closely and taken to a healthcare facility as soon as possible for further treatment. While naloxone is a powerful tool, it's not a cure-all. It's just one piece of the puzzle in addressing the opioid crisis. However, its availability has undoubtedly saved countless lives, and it will continue to be a critical part of harm reduction strategies moving forward. A report by the CDC showed that from 2017 to 2020, naloxone administration helped to prevent an estimated 25,000 opioid overdose deaths. Naloxone is a life-saving medication that gives people a second chance after an opioid overdose. While the opioid epidemic is still a pressing issue, naloxone provides a glimmer of hope for those affected. It's crucial that this medication be made accessible to everyone, especially those in high-risk communities. If you or someone you know is at risk of opioid overdose, Talk to your healthcare provider about naloxone. Could save a life, and it's never too soon to be prepared.